Good morning. President Garnett Stokes, Vice President for Research, Dr. Ellen Fisher, Associate Vice President for Research, Mary Jo Daniel, Provost Holloway, Dr. Jeff Rack, Irene Gray, the Interdisciplinary Science Co-op, Anita Grierson, and UNM's Grand Challenges. Welcome, all of our esteemed speakers and guests. Thank you for the role that you've played to make this second annual Team Research Symposium happen. I'm Dr. Hannah Torres, Director of the Faculty Research Development Office at the University of New Mexico. I'm honored to have the opportunity today to moderate this session on public impact research. Just as teaching and research go hand in hand, as you heard Dr. Ellen Fisher remark, research is education. Similarly, fundamental and applied research support and motivate one another in a symbiotic way. Team research plays a major role both in advancing knowledge and improving society. Across the University of New Mexico, there are countless examples of researchers doing impactful work that helps to positively affect our local communities. The following presentations highlight just a few powerful examples of these collaborations. In the next hour or so, you'll be hearing from Geography PhD student Daniel Beene, Dana Bell from the Cradle to Career Policy Institute, Dr. Noah Painter-Davis from the Department of Sociology, and Dr. Katie Wikowitz from the Department of Psychology. After I introduce each of them and share a bit about their biographies, they will each give a 10-minute presentation on their work, and that will be followed by 3 to 5 minutes for questions. For those joining us via Zoom, the chat is being monitored, so please feel free to ask questions in the chat box as we go. So now, without further ado, our first presenter is Daniel Beene. Daniel Beene will be talking about advancing Indigenous health equity, GIScience, and geographies of Indigenous health. Daniel Beene and his mentor, Yolanda Lin, are the 2022 recipients of the Science for Health for Indigenous Populations Award. Daniel is a PhD student in the Department of Geography and Environmental Studies and a trainee with the Metals Exposure and Toxicity Assessment on Tribal Lands Superfund Research Program at the University of New Mexico. His research explores how geospatial and geographic methods can enrich understandings of environmental and social health disparities on tribal lands in the Western United States. Daniel is also a data manager at the University of New Mexico Community Environmental Health Program. Daniel?
Thank you. So I think my talk is probably.
It's in here already.
Thank you so much. Cool. I'm gonna take this off so I can catch my breath if I need it. Thank you very much for the introduction. So yeah, I'm Daniel. I'm a PhD student in the Geography department here at UNM. Before I dive into this, I've seen the land acknowledgement a lot. This is a little personalized take, but I just want to acknowledge, as many of you know, UNM is situated on the ancestral homelands of the Sandia Pueblo. And there are dozens of other cultures and bodies of knowledge from other tribes in the state. And my research really focuses on the Navajo Nation. So I want to wholeheartedly acknowledge that. So what I work on in the Navajo Nation is the legacy of resource extraction. There's a lot of different forms of resource extraction, oil and natural gas, coal, other hard rock and heavy metals. But that's really overshadowed by this intractable legacy of the 530 or so abandoned uranium mines that are across the entire nation. Now, there's a lot of people who live really close to these mines. And as you can imagine, there are a number of adverse health outcomes associated with exposure to wastes from these sites. And my research really started by looking at environmental pathways, environmental determinants of health. And I quickly learned that you can't really disentangle those from the social pathways and social determinants of health. And so that's where I try to really situate my work. Now, speaking of environmental pathways, those are the routes that wastes and contaminants can take through the environment. And so I've done a lot of modeling on looking at how waste and contaminants are dispersed across space. And so on the Colorado Plateau, where the Navajo Nation is, one of the big factors is wind. There's a lot of dry dust, and that dust can contain heavy metal mixtures that are inhaled or ingested through food. Also, a very important consideration for mines is the deposition of waste through overland flow of water. And finally, in this model, we were concerned and interested in the injection of contaminants into groundwater supplies. So what you see on the right is really just an average overlay of these different pathways to try to get an idea of potential exposure to waste from uranium mines. And it's under continual revision. But speaking of groundwater, the majority of residents of the Navajo Nation rely on regulated water sources. And I should also mention that groundwater is the primary, if not the sole source of drinking water on the Navajo Nation. Now, the rest of the people who don't rely on regulated sources will get their water from unregulated wells. Now, unregulated doesn't mean that it's necessarily contaminated. What it means is that the sources are not routinely monitored and that information isn't necessarily disseminated. So during the height of the pandemic in 2020, the Navajo Nation organized the Water Access Coordination Group. And one of their many goals was to address water insecurity across the reservation. And so they helped us organize, or not us, they helped the University of Arizona organize a team of diverse researchers that includes environmental scientists and epidemiologists and geographers like myself. And so what we did was we took a large compendium of data about unregulated water sources and turned it into this website. It's an interactive mapping website that's now published on the College of Pharmacy's website. And now that it's been published, we're trying to track engagement with it. And we do that mainly with Google Analytics and also just talking to the communities and other researchers. But what we find is that we could probably increase our engagement on the Navajo Nation. So you see these 3 or 4 small dots in the 4 corners area. I'd like those to be a lot bigger. And so what we're doing is working on creating a mobile app version of the website that doesn't require an internet connection. So it addresses 2 very important infrastructural issues. And I just want to briefly mention that the website lists about 1,100 wells. That's by no means all of them. And it's by no means all of the data that we have. We collected information on about 200 other wells under active research protocols, so we can't just share those publicly. But we're working with the Navajo EPA to get them that information so that then policy can kind of move forward in this domain. Now, another important pathway, and this one I think really kind of bridges environmental and cultural dimensions of exposure, is through the consumption of traditional foods like mutton. And so a community in the Navajo Nation approached our colleagues at Beene College in Shiprock and asked simply, if we eat livestock, are we being potentially exposed to metals and waste from these mines? And so another team similarly composed of geographers, epidemiologists, environmental scientists, biochemists got together. And the geographers, what we did was we put GPS collars around some livestock and tracked them throughout a grazing season. And are working on relating that to that potential exposure map I showed a couple of slides ago. And then our colleagues at Northern Arizona University and Beene College collected environmental samples. And then we worked with the community to collect organs and tissue samples from some of these animals that we tracked. And we're trying to relate this together to get a large picture of the grazing behavior, the potential exposures, and the accumulation of metals in tissue that people consume. And so what we want to do is go back to the community and speak with individual livestock owners and the community at large about potential exposures and maybe potential recommendations. But I think this is a good example of how it takes a really diverse group of researchers to address a very pertinent and pressing community need. So I'm not going to spend too much time on this slide, but I have mentioned that there are a lot of compounding social factors. Of course, there are cultural ones, but there are these historical things that we have to take into account that really speak to a historical trauma of land dispossession and exposure and continued experiences of racism and isolation. And those continue to this day, and we can see them inscribed in things like access to services and exposure to different things that can make people sick. And in rural tribal lands like the Navajo Nation, a lot of these social factors are kind of circumscribed by this notion of what it means to be rural. And so that's really where my research falls in, because if we take these exposure models and we just plug in existing data, like these models of rurality that are published by the USDA and some other agencies, it doesn't really tell us a lot. And this happens for a number of reasons. First, there are some really elegant and complicated inputs to these models, but then they output them as just categorical variables. So you're already losing a wealth of information. Second, you can see that everything's kind of blocked into these polygons, into zip codes or census tracts. And so again, you're losing a lot of information and they're not robust, right? So if you change one line, it changes all of the data in that individual polygon and everyone around it. And finally, a more insidious thing that I'm concerned about is that when you use census data, a lot of the time, the boundaries of census tracts tend to fall along the boundaries of reservations. And so you're kind of reinscribing that imperial legacy of land dispossession. And so I argue that we can kind of decolonize our methods if we decolonize our data. And so I'm just going to very briefly speak about this, but this is really kind of the foundation of my dissertation work, where I'm trying to take all of these different dimensions of what it means to live in a rural space and how that affects the provision of health services and other services like access to quality food or clean water, and try to pull apart what goes into these models and understandings of rurality. You'll also notice that there aren't these arbitrary polygons in there. So I'm trying to address that fundamental, like, computational question. And so my goal with this is to try to speak directly to other researchers from different domains and communities about what goes into this really complex and intractable problem of how environmental determinants and social determinants of health work together. So I'm going to stop there. That's my contact information. Some thanks to my committee and some funding partners. So thanks a lot.
If anybody has questions for Daniel.
Yes.
Can you back one slide? I'm just curious as to where these data come from.
Oh, yeah, great question. So there are models produced by Oak Ridge National Laboratory called Landscan. And so it's imperfect, to be sure, but it's an estimated population for every square kilometer across the entire world. And so it starts with census data, but then they use some mapping techniques to work backward, looking at inputs like land use and land cover and nighttime lights to try to see where within these like different census areas people are actually living and spending a 24-hour period. And so that's a really major input to be able to get that smooth surface. The one on the left is modeled completely from that. Healthcare, I got all of the up-to-date information from the primary care inventory. I'm completely blanking on the name. And then access to quality food was from some business databases and stuff. Yeah. Yes.
In regards to the model you're working on for the access to healthcare, can you speak to some of the inputs that you think is like predominantly influencing the output of your models?
Yeah, so the method is it's a pretty standard method in health geography GIS right now called the floating two-step catchment area. So that's essentially a ratio of supply number of primary care providers or hospital beds to demand in terms of population. And so that's really driven by infrastructure. So it's based on a road network. And so one of the things that's not really accounted for in this is whether or not people have a car. And so that's going to be the next step on the model is we have data from a large birth cohort study that can really get into whether or not individual people have a car and access to care and services with that.
Thank you very much. Can you hear me fine in the back? All right, our next speaker, thank you, is Dana Bell, who's going to be sharing about barriers and facilitators to CACFP access in New Mexico's home-based childcare settings. Dana Bell is the Director for Early Childhood Projects and Senior Research Scientist at the Cradle to Career Policy Institute at the University of New Mexico. She collaborates with partners in the early childhood as well as workforce training fields to affect data-informed policy change. Her work with CCPI focuses on state and local efforts to improve outcomes for New Mexico families and children, with projects including multi-year evaluation of New Mexico's home visiting and childcare assistance systems, evaluation of the state's centralized family supports referral system, policy studies of the childcare sector, and multi-year evaluation of a Department of Labor grant to develop coordinated community college workforce training for low-skilled workers statewide. Dana, thank you so much for joining us today. Would you like me to-
Yeah, thanks. Don't mess your computer. Thanks for the invitation to present here on behalf of our research team at the Cradle to Career Policy Institute. Our research is funded by the Robert Wood Johnson Foundation in one of their funding strands that's about equity-focused policy research. And we're part of a national cohort that's really focusing on building evidence for effective nutrition supports for children in low-income families. And it's a $250,000 two-year project, and we're nearing the end of it. We've just finished all of our primary data collection for that also. So I can do this. Putting together our research proposal was really informed by knowing several important things about the state. One, as I'm sure you all know, is that the prevalence of child poverty in New Mexico is among the highest in the nation. And commensurate with that are the rates of child hunger, especially young child hunger and food insecurity. And from the body of work that we do, we know that where young children spend a great deal of their time, at least a portion of every week is in paid childcare somewhere other than their home. That's where they're accessing or not accessing nutritious food. And so that sector, the childcare sector, is a valuable place to inquire and explore and address child nutrition. And we also know from community-based research in New Mexico that in our populations of interest, Spanish-speaking immigrants and families in rural areas in the state are disproportionately likely to choose childcare in home-based settings. And the childcare sector can be very formalized center-based care, and it can be home-based care with various degrees of regulation, from completely informal to lightly regulated by the state to ensure safety, safe settings, and to bring some supports like nutrition supports. And a lot of the settings are home-based businesses by women of color in the state. A lot of them can be abuelas and tias who are taking care of some related family members and some unrelated members. And then we also know about the major federal nutrition safety net program called the Child and Adult Care Food Program, or the CACFP program, that provides reimbursement to child care providers and home-based providers for providing meals that meet nutritional standards. So putting all those pieces of expertise and knowledge of the policy environment in the state together, we framed our research questions, which are looking at whether low-income children in New Mexico are being cared for by child care providers who are enrolled in this federal nutrition safety net. And are there differences in that access by the type of setting, particularly home-based care versus center-based care where children are, or are there different likelihoods of children being connected to that program by family or geographical characteristics? And I will just say I'm already excited to know Daniel and that he exists, because that question of data sets around geographies of rurality are a really big question in the state. So I'm really happy to know you. That research question we're addressing by analyzing state administrative data sets, primarily through partnership with the Early Childhood Care and Education Department. Then we're also interested in really probing what kind of barriers child care providers experience in participating in the program, from understanding their eligibility to participate to what enrollment is like and what it's like to meet all the requirements to continue participating in the program, and how those barriers could be addressed to ensure more equitable access for the children in care around the state. And for that, we did statewide interviews, both with the what are called sponsor organizations. They are intermediary organizations based in communities who basically serve to administer and train and support providers in this program. And then the home care providers themselves. And we worked very hard to reach both home care providers who participate in the nutrition program already and those who have chosen not to participate in the program. To pause kind of quickly on our cross-campus research team, we have a main campus team at the Cradle to Career Policy Institute, working with health sciences with the Department of Pediatrics with a longtime partner. And at CCPI, we're located in the College of Arts and Sciences. We bring kind of a long 8 to 10 year history of applied policy focused work across the age spectrum in education related fields, but we've built a particularly strong body of work in the early childhood education field, and we bring longstanding partnerships with some key state agency partners, but also working groups in the state and the provider networks. And we've built a bilingual research team that includes staff and graduate students from various departments, which is just key to having the reach into the communities and providers in the state who are in our communities of interest, are very largely Spanish speaking, and a strong mixed methods expertise. And then we've been able to partner with Dr. Beth Yates Jimenez from the Department of Pediatrics from the Envision Applied Research Center also, who's been a longtime collaborator and partner and really mentor to our team over the years. She brings with her team strong expertise in policies and practices around child nutrition and maternal health and food security. Also brought with her bilingual health educator on her team and a staff that are strong in epidemiology and quantitative work. And also knowledge of the peer-reviewed journal world in the nutrition field. We're much more educators, so it was really great to have access to that. Then in terms of our findings, preliminary, we still are analyzing our last set of field data that we've collected. We were surprised to find a really high level of access for low-income New Mexico families to the food program through their choice of provider sites. The level, it's in contrast to nationally representative studies that show, we're in New Mexico right now, we're seeing 86% access of low-income families through their providers. Nationally, that's more like 60%. And in some of these studies, the home-based providers is as low as like under 10%, and it's just as high. And I think the important policy finding we found is New Mexico has perhaps a unique policy environment around the policy levers that's used around this program, in that it is allowed and in many cases required the home-based providers to participate in the nutrition program. Most states limit participation to the highly regulated or licensed providers, which privileges sort of the participation by center-based care. And those are different policy lever choices, whether you're in sort of incentivizing participation in regulation for quality and all of those inputs. And New Mexico has said we're prioritizing it as a nutrition policy lever and using other policy levers to address some of other policy objectives about professionalizing care settings and bringing quality to that. And we think that that will be a really important model for what that policy choice has meant for the reach of low-income children to those supports. And also found that the pockets of low-income families living in higher income areas, their providers are not connected to the food program to the same levels. So for instance, in Los Alamos, there can still be low-income children from low-income families who are receiving care, but not in a center that's participating in a program that's perceived as for low-income areas also. So there's, I think, good room to really examine that and look at some policy levers. Then in terms of barriers, by really talking to people about their lived experience and their cost benefit choices of whether to participate in the program or not, I think I've identified a number of operating regulatory barriers and experiential barriers to participation that can still be addressed. Some are environmental. Providers in more rural areas have much more difficulty accessing the foods that are required to be in compliance with the nutritional standards. Universally, at the programmatic level, participants will say that the reimbursement rates are not high enough. That goes into the cost benefit analysis, when there's also a perceived very high administrative burden. And again, so many of these participants are running small businesses out of their home and may not think of themselves as business people. So there's still those administrative barriers and lack of adequately translated or appropriately materials that are pitched at the appropriate literacy level also. So there's some, I think, policy recommendations and levers that can be moved. And our dissemination plans include those practitioner partners in the state, the policy world in the state agencies, but also to elevate New Mexico's experience and what is to be learned about really concerted efforts to ensure equitable access for kids on the national scene. And that's both at some national public policy conferences. My co-PI is presenting, strangely enough, at the same time today at the National CACFP Sponsors Conference about the findings, and also presented at the National Anti-Hunger Conference together with some practitioner partners from the southern part of the state on the panel. Really want to elevate the lived voice experiences into the policy realm. And we'll continue on with some journal publications. So really hope that the impact affects some policy change, both at the state level and nationally. And that's our team. Some of our team is here. Thank you for being here also. So thanks. Any questions? Daniel.
Yeah, thank you so much. One thing that I've been interested in my work is trying to distinguish or how to address like quality of care in these underserved areas, as opposed to just one, which is all I'm really doing. Do you have any insight on how we can understand quality in this like measurable way?
Yeah, that is an enormous question in the early childhood field. The state is working on a lot, and there is a quality rating system that really measures like research-based inputs into what are the facilities like, what is the training like, what are the programs like that are offered in early childhood settings. And there's more and more discussion about how to bring supports around those quality inputs to the full range of childcare providers, home-based providers. There's some really concerted efforts in the state right now to bring shared services and trainings and to really like offer professionalization on the terms of that set of providers. And those questions became really acute during COVID. If anybody here had young children, this sector, the workplace fell apart, right? Public health fell apart, and the demand for care that families felt was safe and comfortable really put a highlight on that home-based sector. They really like stepped into the void. And so I think there's a realization that families value that and that business might not continue as usual from before the pandemic. And to really honor where families want to have their children in care means bringing those quality supports where that happens, including subsidized care and nutrition supports, and also education and developmentally appropriate care to those sites also. So I think the field is really shaking up those questions and thinking how to be more creative and effective and research-based and all of that.
Thank you so much,
Thank you.
Dana. I've been very curious about the Cradle to Career Policy Institute, so I'm
Here we are.
glad to have heard from you today. I'm glad that you got a chance to connect with Daniel as
Thanks.
well. Our next speaker today is going to be Noah Painter Davis with a presentation called First District of New Mexico Juvenile and Young Adult Diversion Program. Noah Painter Davis is an associate professor in the Department of Sociology. His research focuses on developing programs and practices that reduce crime and inequality. As part of the National Institutes of Health funded study, he's working with parole officers and health providers to improve the linkage of released prisoners who use or are at risk of opioid use to treatment services within their communities. He is part of an interdisciplinary team working to develop and implement a diversion program to reduce inequality in the criminal justice system among juveniles and young adults in New Mexico's first judicial district. He's won a new Faculty Teacher of the Year award and is undergraduate director of the Sociology department. Noah, thank you so much for joining us today.
Thank you. I'm gonna go without the microphone because I can talk loud.
Okay.
Too many things to hold on to.
The Zoom people may not be able to hear you. That's the biggest issue with that.
Yeah. Well, there's microphones up
Okay.
here. So send us a note in the chat, Zoom world, if you cannot hear well.
Okay, I'll talk loud. Good morning. Thank you for giving us the opportunity to speak with you today about the development of re-envisioned diversion programs in the first judicial district of New Mexico, which includes the counties of Santa Fe, Rio Arriba, and Los Alamos. We have received funding for this work from the William T. Grant Foundation and the Colin Alma Foundation. I also want to thank the Tree Center and the Research Allocation Committee, which also supported relevant work to this project on examining racial and ethnic disparities in sentencing in New Mexico. This project involves an interdisciplinary team. They have not had a chance to review the slides and presentation, so any errors are my own. We are in the relatively early stages of the project and are continuing to build our team and excited about adding new team members. Public safety and crime are complex and require multifaceted solutions. Although the criminal justice system, henceforth the CJS, plays an important role in public safety, the United States has overly relied on the CJS and punishment to address public safety issues. The CJS also has serious flaws, and as such, contact with it often leads to consequences. These are often concentrated by race, ethnicity, and socioeconomic status, leading to inequalities. The objective of our project is to develop re-envisioned diversion programs for juveniles and young adults that reduce contact with and reliance on the CJS. We want to reduce the footprint, that enhance youth well-being, that reduce inequalities, and that address gender differences. Our guiding principles of our program include improving collaboration, increasing service provision, and investing in communities and community input. Diversion is intended to minimize formal criminal justice system involvement and its consequences for clients while still holding them accountable. They draw on alternatives to more punitive approaches and may or may not involve linkage to services. Diversion practices can occur at several stages. At the front end of the system, diversion can happen at any point prior to sentencing and can even happen prior to arrest, right after the incident. At the back end, diversion may involve alternatives to incarceration. Front-end practices are more in line with true diversion as they're better able to limit any negative consequences of the criminal justice system. Our programs are being designed to occur at the front end and at various stages, and they may or may not involve criminal justice system involvement depending on when diversion occurs. Diversion's effectiveness could be measured in multiple ways, such as decreased CJS involvement, increased individual and community well-being, and positive system changes. Evidence of the effectiveness of diversion programs, however, is mixed. While some research suggests that diversion programs can be effective, other research shows they often have serious pitfalls that reduce effectiveness and increase inequality. Despite the pitfalls, research suggests that diversion programs could be more effective if they are focused, individualizing interventions to the specific risks and needs of individuals, balanced, placing a relatively equal emphasis on accountability, rehabilitation, and redemption, and fair, ensuring that processes are perceived as fair and that unwarranted differences in program access and impact are minimized. However, focused, balanced, and fair approaches are rarely designed and rarely implemented. This is in part due to prominent barriers. Our project is working to address these barriers, and I will briefly discuss two. One problem is silos, the lack of communication across individuals and entities, especially the lack of community engagement. Silos lead to a lack of information sharing. They lead to a lack of resources, trust, and understanding. They also lead to untapped knowledge, all of which are needed. All of these things are needed to develop and implement focused, balanced, and fair approaches. We need to break down these silos to create more communications and better options, including those that are outside of the CJS. We have begun breaking down these silos and are taking several steps to engage the community. For example, in the summer, the team will be taking training in community-based participatory research. We will begin recruitment of community members and former justice-involved youth to get feedback on what a diversion program should look like. And we're going to be doing outreach to the community to involve them in the leadership and development of the project. Another prominent barrier are data limitations. To have effective diversion practices, it is necessary to have full information on how and why a person enters the CJS and the path their cases take. In New Mexico's data, unfortunately, we can only readily see what happened to an individual after they were convicted and sentenced, and not what happened at the several steps in between. Thus, we cannot fully assess system effectiveness and opportunities for improvement. To begin addressing this issue, we have begun a prototype database by scraping various data systems across the state and through document review. The DA's office also recently received funding from the legislature to improve their data system, and the team will be helping them design those improvements. To reduce inequality, we need to know whether and where are existing inequities and the likely impact of interventions. However, New Mexico's data on race, ethnicity, and socioeconomic status are severely limited. For example, race ethnicity data is only currently collected systematically for those who are convicted and sentenced to prison, parole, or probation. This means we do not know how race ethnicity shapes outcomes earlier in the CJS process. Also, studies often analyze racial inequality by introducing race as a dummy variable in the model and interpreting the difference in outcomes between racial and ethnic groups as racial and ethnic inequality. This is entirely insufficient because it obscures the causes of racial and ethnic inequality. It doesn't capture how America's policies, including laws, cultural content, and history, have had adverse effects on people of color in ways that have exacerbated inequality. Categorical approaches to race also don't capture important variation within racial and ethnic groups. We are beginning to address these problems in creative ways. First, we are doing our best to impute race and ethnicity data at earlier stages of the system by integrating alternative databases throughout the state and through surname analysis. Second, we will be coding policy variables and laws and examining how they affect disparity. Third, we will look at how implicit signifiers of race, such as surnames, impact racial and ethnic inequality. In Bernalillo County, for instance, we are studying how skin tone affects sentencing and how the effects of observer-reported race differ from the effects of self-reported race. Similar approaches can be used in the first district. Fourth, we will make collecting better race and ethnicity data a central feature of the diversion program and data system. As we move forward, we are emphasizing two guiding frameworks which are compatible with team science. Implementation science examines methods to promote their integration of research findings into practice. It works to identify and address some of the barriers we identified earlier and facilitators to uptake, fidelity, and sustainment of best practices at multiple levels, including the client level, the organization level, and the community level. However, we need to do better. Implementation science needs to be improved to better understand how inequalities can be baked into practices and into policies of organizations. A system that functions better in several respects could still lead to inequalities. Strong implementation science approaches need to center reductions in inequalities as a core marker of success and a core goal. Second, we are prioritizing community-based participatory research, which emphasizes incorporating the community as equal participants in research as a method to build capacity to implement and sustain change. Central to community-based research, it is crucial that we strive to democratize knowledge by prioritizing the community's input. Indigenous groups have a long history of diversion practices, restorative justice practices that we can learn from. Community members are often left out of conversations about how to implement policies and programs. Part of this process involves recognizing and incorporating multiple viewpoints in order to refine our group's ideas and to make them suitable and sustainable in the local context. This also involves challenging and giving each other feedback and recognizing our own assumptions, as well as how we might be perceived by community members. Thank you.
Questions for Noah?
Yes.
So I heard on NPR, and there was an article just a couple days ago about how Florida is working on, Florida is implementing a I forget what they call it, but a complete sentence for violent offenders that they want to, and I may have the state wrong, but anyway, that people have to fulfill their complete sentences that they're sentenced. And there was a counter argument that then impacts reform efforts, or having people move back into society after having done a sentence in jail. So I'm wondering about how those kinds of laws impact your ability to do the community-based participatory research, including the restorative justice kinds of aspects of, when and how are people allowed to go to get back into society?
Great question. Well, in order to build public support for this project, we're probably going to start pretty thoughtfully and think about what the public is ready for. So we might not start with diversion programs for violent offenders, even though I do think that's possible. What the policy environment, how that affects the implementation of laws is a lot looser in New Mexico than other places. So a lot of places are sentencing guideline states where if a individual has a particular criminal history and commits a crime, they have to be sentenced according to particular rules and structure. We are not a sentencing guideline state. So the prosecutor has a lot more power and the judiciary has a lot more power to craft sentences. For instance, in the first district right now, the district attorney's office is actually, of all misdemeanors, they're only prosecuting domestic violence and DWIs. They actually dismiss all the other misdemeanors, not completely out of a goodness of their heart because they don't have the resources to do it. But I guess what I'm saying is diversion is actually already happening in several respects. And so one thing we need to do is study that. And the good thing about this project and the district attorney in New Mexico is that they have a lot more leeway. You're welcome.
Thank you so much, Noah. I appreciate it. Our final presenter for this session is Dr. Katie Wikowitz. Sorry. Her presentation is entitled Dissemination and Implementation of Mindfulness-Based Programs in New Mexico Communities. Katie Wikowitz is a Regents professor in the Department of Psychology with a joint appointment in the Center on Alcoholism, Substance Abuse, and Addictions. The underlying theme of her research is the development of empirically based models of alcohol use disorder with an emphasis on harm reduction and the application of person-centered models to better understand individual changes in alcohol use over time. She's also a licensed clinical psychologist and has worked extensively on the development of a theoretical model of biopsychosocial influences on alcohol use and relapse. Katie, thank you so much.
Thank you. Can you all hear me okay? Great, and this is the place to stand? Okay, awesome. Thank you so much. It's really great to be here in person. This is my first in-person talk at UNM since January 2020. So thank you all for being here and thank you all for being on Zoom as well. I also really want to thank Dr. Fisher for supporting Team Symposium. This is great. This is new at UNM and I really love it. And a huge thanks to the Grand Challenges who have supported the Substance Use Disorder Grand Challenge has supported a lot of this work. I'm also really excited to be following Drs. Aurora and Dan and Dana and Noah. I feel like everything that's been talked about today really is aligned with some of my work and I'm excited to talk with some of you about ideas afterwards. And Noah and I actually have a meeting on Thursday to talk about diversion. So it's really great. Okay, we're set to go here. Excellent. Maybe not. Just about. Almost. Well, I have more people to thank. So I want to thank, of course, President Stokes for her support of the Grand Challenges, the Regents for their support of the Grand Challenges, and Anita, it's been great working with you on the Grand Challenges. And I'm excited for the next session on re-envisioning them. It's a fabulous program that's really supported a lot of great work at our center and across UNM. So I'll talk a little bit about dissemination and implementation of mindfulness-based programs in New Mexico. I also wanted to note, though, it's funny, as I was listening to Dr. Aurora's talk, we have 2 grants under review using ECHO for opioid use disorder and chronic pain, as well as trying to help providers in doing medication-assisted treatment for opioid use disorder. And we have a grant in development to develop mindfulness-based training via ECHO. So it was really great to hear from him this morning. I want to start with some disclosures. So the research I'll talk about was supported by many grants from the National Institutes of Health, as well as grants and funds from a prior institution, Washington State University, as well as UNM. I also have a book that I've published on mindfulness. So I'd like to acknowledge that all the proceeds of the sales of this book go to a scholarship fund in honor of my former mentor, Alan Marlatt, who passed away in 2011. And so we provide scholarships to providers who want to get trained in mindfulness-based programming from any proceeds from this book. And I have no other conflicts. So can mindfulness be effective for helping people with harmful behavior, including the majority of my work focuses on substance use disorder and addiction. But more recently, we've been extending that to focusing on other types of harmful behavior, including aggression. And we've done many years of research, and even though it's a research team symposium, I'm not going to talk much about that research other than to say that we have found it to be very effective. And so I'll say a bit about why we think it's effective. But to start, I'd actually like us to engage in a little mindfulness practice together for those of you who are willing, and you don't have to be doing it, because I don't know, because it's in your head. But if you're willing and want to play along, and those on Zoom as well, you can do this too. And either eyes open or closed. I'd love for you to just take a moment to just actually ground yourself, to notice that you're in a room somewhere, and maybe notice that you're actually breathing. We can always connect with the sensations of breathing. You can keep your eyes closed or open, whatever's more comfortable for you. And once you kind of are in your body a little bit, noticing some breath happening, maybe bring to mind, if you're so fortunate to experience some triggers in your life, things in your life that you don't like. Maybe think of a specific one in the past week, maybe not the biggest thing, maybe not the biggest problem in your life, but a small thing that has triggered you to have some sort of reaction. So maybe bring this situation to mind, and maybe already notice what's happening. Maybe your heart rate is starting to increase. Maybe you're noticing some sensations of tightening in the chest or in the belly. And maybe kind of notice what might happen next in this situation. Maybe you have some thoughts or reactions or emotions about the situation. Maybe it continues to grow. And now allowing that situation to just fade into the background as best as you can, and coming back to just sensations of breathing. If the situation feels really overwhelming, you might draw your attention to places where your body is held to the earth. The gravity is grounding you and pulling you down. Maybe taking a few deep breaths and rejoining the room again. Okay, so if we had a longer time, I would ask about some of your experiences and ask you to share. But for now, I'll just say that maybe what some of you noticed is that if you were fortunate enough to have a trigger in your life, which, by the way, the first noble truth is that being human is suffering, is pain. And so we all experience triggers. It's kind of a natural part of humanity. And maybe you notice that when you get triggered, maybe even in this imaginal situation that you brought to mind, that it kind of grows, right? Like this trigger kind of causes this chain reaction of emotions and thoughts and reactivity and ideas. And this is kind of a natural human tendency. It's actually the second noble truth. And so this is this natural tendency for us to become overwhelmed with triggers. And what happens though, is that this can become even bigger and bigger and bigger. And ultimately, this is an explanation for why people engage in substance use behaviors, aggression, other forms of harmful reactivity, non-suicidal self-injury is another example of this. And these are strategies for coping with this human experience, this very human experience of experiencing triggers, and then all of the reactivity and things that we add on to those triggers. Now, I want you to imagine that same situation that you just imagined, but imagine just allowing that situation to be present and not adding on all of the stories and emotions and reactions and thoughts, and just maybe taking that same trigger and holding it, just bringing non-judgmental awareness to that same exact situation, not allowing the storytelling and the making it bigger and bigger and bigger than maybe we tend to do as humans. And this is exactly what we're doing in mindfulness-based treatments for addiction and other harmful behavior, is we're training people to bring non-judgmental present moment awareness to their lives, to their triggers, and to be able to hold them. Because ultimately, the triggers don't cause as much problems as all of the reactivity to them. It's the reactivity to the triggers that actually gets in our way. And so what we're training people to do is just be with the triggers. We're also training people to not only stay with discomfort, but also to really show up for moments of joy in their life. So for me, I've always had dogs. I love dogs. And walking my dog. If I'm ruminating about all the stuff I have to do today and all the stuff that is getting in the way of what I have to do today, I'm gonna miss that. Or I could just walk my dog and really enjoy walking my dog. First sip of coffee in the morning. I went to grad school at University of Washington, Seattle, where you basically have to drink coffee to survive because it's so terribly gray. But my first cup of coffee in the morning, that first sip, if I really show up for it, it's beautiful, it's gorgeous, really wonderful. So we can also not just stay with triggers, but stay with and really appreciate the joys in our life and really savor them and nourish them and be present for them. So we train this too. It turns out that there's brain-based explanations for both why this happens, why this process of reactivity happens in humans, but also why mindfulness might be effective at turning down the volume for individuals with substance use disorders and other harmful behaviors. We know that there are many regions of the brain that are involved with reactivity, they're involved with addiction. But what we can do in mindfulness-based treatments is basically decrease bottom-up reactivity to these triggers in the brain, but also engage greater top-down control so that individuals are more likely to be able to sit with and cope with triggers in the moment. And so we've done research and currently have research underway, further trying to understand these neurobiological mechanisms of why this treatment is so effective for helping people. What I came here to talk about today is actually our implementation work and our impacts here in New Mexico, which we hope to expand to globally per the ECHO program eventually. But we started in New Mexico, and when I arrived in 2012, I recruited a group of grad students, 5 graduate students who are interested in working with me in disseminating and implementing mindfulness-based programs here in New Mexico. So we started a collaboration that's ongoing with Turquoise Lodge Hospital in their residential treatment program for substance use disorder, providing mindfulness groups in that setting. So this was kind of the original set of 5 graduate students. And we really worked in an implementation science lens to culturally adapt the treatment to that setting, to make necessary changes, to improve the treatment, to make it fit within that program. We've since expanded to many more students, as well as postdoctoral fellows, and to many other settings within the local Albuquerque community, including Crossroads for Women, which is actually a diversion program or a step-down program from prison for women. We've continued our work with Turquoise Lodge Hospital. We expanded to Indian Health Service, the Transgender Resource Center, as well as Albuquerque Police Department. We've continued even more with more students in the UNM psychology program, as well as more scientists at the Center on Alcohol, Substance Use, and Addiction. We've also expanded to training providers across Bernalillo County in collaboration with the MI Training Center. We got a grant from Bernalillo County to train 60 providers per year for 3 years. We just finished our 3rd training. So we've trained 180 providers in the Bernalillo County area in this intervention to deliver this program at their programs. I'd like to just highlight 2 specific projects, or 3 projects that we're pretty excited about. One is we're currently conducting a study with veterans at VAs, both in New Mexico, the New Mexico VA, as well as San Francisco VA and Puget Sound VA, on using this mindfulness-based program for chronic pain and opioid use disorder. But most importantly, we're doing it in a very implementation science way. So we're training providers and trying to change the system in the VA. We're actually doing this via telehealth. So if it's found to be effective, we'll be able to disseminate it to all veterans nationwide. We've also, a former student who's now at Yale, Corey Ruse, developed the first ever rolling admission program. And this is really important because people start treatment at various times. You can't always just do a single course. So we've been able to do this rolling admission program. And he's now adapting that to be computerized and delivered via the web, which will obviously greatly expand the reach of the program. My newest incoming grad student, Ikela Lewis, has just started a collaboration with HopeWorks and Hope Village. Hope Village is an incredibly exciting housing program here in Albuquerque that really tries to help people who've had a lot of difficulty obtaining housing to have permanent housing and to use that as the first step to ending homelessness. We've just started mindfulness groups at Hope Village. Jaylene Heron, who is the former SHIP awardee, is starting her dissertation, proposing it soon, to adapt the mindfulness program for patients at Indian Health Service. And this is really important because we'd like to be able to disseminate this widely to other Indigenous communities. And then, as I mentioned, we're actually just wrapping up this study that focused on resilience in police officers and reducing stress and aggression in police officers. And so we just wrapped up these programs for Albuquerque Police Department, but more importantly, have trained people in the Albuquerque Police Department to keep the program going. So it's not just us doing the work and then leaving, it's us doing the work and then making it sustainable in place. And I think that's really critical. So here's some links if you're interested in any of this or want to do more mindfulness practices. We have lots of audio recordings available, and there's a lot of information about the research as well. Thank you.
We have time for probably one question for Katie. Any questions? Yeah.
Also an opportunity without being a mental health care provider or expert at that level, but this is also being rolled out to complementary healthcare so that people sort of in that echo model, learning to teach and all of that are then able to roll that out in these kinds of settings without going against any kind of regulatory issues.
Yeah, great question. So the question is whether this can be rolled out beyond just like mental health into other healthcare settings. And we're actually currently testing this and as part of a large pragmatic trial in nurses. So training nurses in some of these approaches. But I think absolutely like that's actually kind of part of the idea with ECHO is that we could, there's something too about using these practices as healthcare providers. We know that healthcare workers are experiencing a lot of burnout right now, have just, been leaving the field. My mindfulness practice, and I think other people would say their mindfulness practice helps them stay in the field and helps them remain compassionate and empathic. And so I think it would be a critical next step for sure. Thanks. Yeah.
It's just as a holistic healthcare practitioner, there's always this nervousness around scope of practice. And although this kind of happens automatically in that setting, are you allowed to name it? So.
So our program, we explicitly developed without a certification process. There are like mindfulness-based stress reduction has a certification process that's very expensive and time consuming. And we don't want that kind of situation. We want to give this to anyone and teach it to anyone. It's been given away by Buddhist teachers for 2,000 years. So who are we to put our name on it, right? So absolutely, yeah. We like to train people and help people bring this into their practice if they can.
Thank you, Katie.
Thank you.